provide hand hygiene. Hi, my name's Callie. I'm going to be your nurse today. Can you tell me your name, date of birth, and any allergies? Okay, I'm going to check the order to make sure we have the correct type of tube to insert the Foley catheter. Providing privacy, explaining the procedure to the client. I'm going to gather my supplies, raise the bed to working height, and don gloves. I'm going to place the female patient in dorsal recumbent with knees flexed and the male patient with the legs supine and the thighs slightly abducted. I'm going to inspect the perineal area and provide hygiene if necessary. Then I'm going to remove gloves, hand hygiene. I'm going to open my sterile kit, tabbing away from me. Then I'm going to apply sterile gloves and grab my sterile sheet. I'm going to place it down, remaining sterile with the patient. I'm going to remove my tray, opening my swabs. I'm going to open my lubricant, place it there, and throw it out. Then I'm going to open my syringe, removing the cap, and inserting it onto the balloon pump, but not actually doing it yet. Then I'm going to place this in the lubricant. I'm going to clean the female client's perineal area, so I'll retract the labia, wipe up farthest from the fold, then near the fold, and then down the center urethral meatus. Then I'm going to take the catheter, slightly coil it in my hand, and start to insert it into them. But before I insert it into them, I'm going to ask them to bear down. Once they're bearing down, I'll tell them I'm going to insert it now. It's going to go in. Once I start to see urine coming out, I'm going to do it another 1 to 2 inches. I'm going to stabilize it by holding with my non-dominant hand, and I'm going to use the balloon, like make a balloon in it. Once I have my balloon, I'm going to try to tug to make sure it's in there good. Then I'm going to secure it to the leg using the stat lock. I'm going to remove the drainage bag and place it on the end of the bed on the correct placement. I'm going to cleanse the area one last time. Then I'll remove my gloves. I'll dispose of my used supplies, so disposing of all of this. I'm going to lower the bed, provide the call light, and document the procedure. Before I start the next one, I'm going to empty this. Okay. Now I'm going to remove their Foley catheter. So hand hygiene. Hi, my name's Callie. I'm going to be your nurse today. Can you tell me your name, date of birth, and any allergies? I'll check the order to make sure we have an order to remove it. Once I see we have an order, I'm going to gather supply. Oh, actually, I'm going to explain the procedure to the client. Then I'm going to gather my supplies, raise bed to working height, don gloves. I'm going to enter my empty my catheter bag or drainage bag and measure it. Then coming over to the client, I'm going to place a waterproof pad underneath their buttocks. I'm going to remove or detach it from their leg, and then also detach it from the side of the bed. Once I've done that, I'm going to use my empty syringe to remove the balloon. But I will be doing this by gravity on a real patient. Okay. Then I'm going to slowly remove it. Once it's out, I'll dispose of that and dispose of that. Then I will cleanse the area one last time. Once I've done that, I will remove my gloves, dispose of used supplies. Once I remove my gloves, I'll provide hand hygiene, and then I'll lower the bed, provide call light, and document the procedure.